Good afternoon and welcome to the National Prevention Week 2019 webinar series. Thank you for joining us. Today's webinar is being recorded. At this time, I would like to turn the webinar over to our moderator, David Lamont Wilson from SAMHSA. Please go ahead, David.
Welcome, everyone. I'm David Wilson, the Public Health Analyst at the Substance Abuse and Mental Health Services Administration's Center for Substance Abuse Prevention, or CSAP. And I'm also the coordinator for SAMHSA's National Prevention Week program. And so today I get the honor of being your moderator. Now, as we know, our public health infrastructure is stressed due to limited resources and the opioid crisis, and communities are really struggling with the consequences of substance misuse. And the prevention workforce comprises of people with different backgrounds and trainings in multiple disciplines, mostly in the social sciences and healthcare. However, each of us has and can also play a role in prevention and become prevention champions. And communities need preventionists, those who work full-time on substance misuse prevention in the public health arena. And we also need prevention champions, passionate individuals and organizations that are invested in creating healthier communities. Now, prevention champions are hard at work every day in their workplaces and communities, and today's panel of champions will discuss how they integrate substance misuse prevention into their work and how prevention supports their programs, their missions, and their goals. Now, our discussion will provide widely different approaches, tools, and resources for finding prevention champions in unexpected environments and disciplines. So before we begin, I'd like to take a few moments to go over a couple of housekeeping announcements. One, I want us to please use the chat pod to send us your thoughts and your questions throughout the webinar. I will pose questions to our panel following their brief introductions of their work. Two, this webinar is being recorded and it will be available on SAMHSA's YouTube page. So if you have colleagues or coalition partners or grantees who weren't able to join us today, they can access it on demand when it's available. And three, we will also make the slide presentation available after the webinar, so you'll have all of the information and all of the resources that we discussed today at your fingertips. Now, we have three very exciting presenters on our panel today. First, we have Alissa Osenberger, who is the Deputy Director of ACT Missouri. We have Dr. Daniel Smith, the Director of Addiction Services at the Mary Center. And we also have Reverend Walter Jones, who is the founder and the Executive Director of Fathers Who Care. Now, each one of these presenters will share with us some background on their work before we dive into this larger, hopefully very rich panel discussion, including answering a few of your questions as well as some questions that we think are most pertinent for them to talk about today. But before we hear our presenters, I'd like to take a few moments to talk a little bit about National Prevention Week, because it's almost here. National Prevention Week 2019 kicks off on May the 12th, which is about 19 days away. And this year's theme for National Prevention Week is Inspiring Action and Changing Lives. And this theme reminds us that we can all inspire positive change every day and everywhere, whether we make healthy choices for ourselves or inspire others to do so. Those small actions we take can change lives for the better. Now, as you'll hear today, our webinar panelists and their organizations are great examples of inspiring action and changing lives. So, each day during National Prevention Week in May, we focus on different pressing health themes, and we encourage you and your communities to focus on these various aspects of prevention. Communities around the country, they host health fairs, trainings, mural paintings, town hall meetings, Twitter chats, and other national prevention activities and events to contribute to our growing conversation about prevention. So, what are you doing for National Prevention Week 2019? We want to hear about it. So I want you to submit your events on SAMHSA's website, and we can also help promote your community's event through our Prevention Works email and on the NPW website. You might even find yourself featured in the annual NPW Outcomes Report or next year's National Prevention Week Planning Guide and Resource Calendar. We also have a very exciting challenge going on around National Prevention Week called the Prevention Champion Challenge, and I think it's really appropriate for today's discussion and webinar. So what's your prevention champion? Now, as we explore during this webinar, a prevention champion is a person, an activity, a program, an organization that inspires others to take prevention actions every day that change lives. Prevention champions could be a colleague at your organization who is leading the charge on an innovative substance abuse prevention program. Or it might be the Silver Sneakers program at your local YMCA that is helping seniors get in shape. But look around you. Whoever or whatever it is that is inspiring people to take prevention actions that change lives, we want to hear about it. Who in your life that you know personally or would love to meet is living the life you aspire to lead? Who is influencing the choices that you make every day to take care of your health? What programs are helping others in the community thrive without substances? That person or that program is your prevention champion. So, pick a photo or a video that represents your prevention champion and a word that best describes how they help connect you to a healthier life. Then post your photo or video and word to social media using the hashtags Prevention Champion and NPW 2019. And then, as is customary with all challenges, I'm challenging you to challenge others to do the same thing. Because you might find that sharing your prevention champions inspires others. So share your images today and challenge others to do the same. Now, it's never too early to look ahead, and we're already thinking about National Prevention Week 2020. So as I mentioned earlier, we would love to feature your community in the next National Prevention Week Planning Guide and Resource Calendar. So next year, our goal is to only use pictures and photos of other organizations that show real inspiration, real prevention, and people across the country that are doing this excellent prevention work. We want to showcase the prevention efforts taking place year-round by featuring your photos. So be sure to capture pictures of your activities during this year's National Prevention Week that you can share with us. Now, they might be included in the Planning Guide and Resource Calendar. And so here's a few tips to help you take the best photos possible at your event. Your NPW event or activity is a great time to showcase your organization's impressive prevention efforts and inspire others in the community. Now, we encourage you to take high-quality photos at your event and send them to us for the opportunity to be featured in our future NPW promotional materials. So visit the NPW website to learn more. And as a reminder, you can still download a PDF of our Planning Guide and Resource Calendar in the SAMHSA store. And you might wonder if the MPW Planning Guide and Resource Calendar is still useful to you now that MPW is already here or almost here. Well, it definitely is. The calendar is a truly helpful tool to use all year round. Let me say that again. It is truly a helpful and useful tool to use all year round and to learn about other prevention resources. So in addition to taking part in the Prevention Champion Challenge and planning and documenting what I know is going to be some really fabulous and inspiring MPW activities, get involved with MPW by visiting samhsa.gov/Prevention Week. That's samhsa.gov/Prevention Week for the latest prevention resources, for the latest tools for prevention activities and events in your community, and for information to share on your social media using the hashtag MPW2019. Now, I'm going to stop talking, but I hope that you all are as excited as I am about MPW 2019 in 19 days. Now, prevention is happening every day. And like I said before, everyone has a role to play in making our communities healthier, which is why we're doing this particular webinar. So, before I get to the presenters, I'd love to share with you guys a video that highlights what we believe National Prevention Week is all about.
We serve the entire state of Missouri.
On the west side of Chicago.
Serve families that live in Washington, D.C. Prevention is at the core of what Mary Center does, whether that's mental health, physical health, school readiness.
Drugs, alcohol, mental health, suicide, underage drinking, and tobacco use.
Marijuana, all the way up to opioids, cocaine. If it's a drug, we are there to try and prevent it.
National Prevention Week is a celebration of all the things that happen all year long.
Some of our National Prevention Week activities have been focusing on the illegal drugs, illegal use of opioids.
Prevention is about saving lives.
This is where it happens.
This is where it happens.
This is where it happens. This is Prevention at Work.
Every time I watch that video, I get so moved and inspired. It celebrates prevention champions and their dedication, their passion, and the action that is happening in communities across this country regarding substance misuse prevention. Now, I'd also like to note that the three communities featured in that video, Mary Center, Act Missouri, and Fathers Who Care, are also the organizations featured in today's video, in today's webinar, I'm sorry. So we would love for you to share and use this video in your NPW activities and events. We offer the full video and a customizable version for download on MPW's website. So please download the customizable video and add your organization's logo, your website URL, or other information to promote National Prevention Week as well as your organization. So, before we jump into our panel discussion, each presenter will share more about their background and work. And our first panelist is Dr. Daniel Smith, Director of Addiction Services at Mary Center. Dr. Smith attended medical school at the University of Pennsylvania School of Medicine in Pennsylvania. He completed his residency at the Swedish Family Medicine Downtown Public Health Center in Seattle, Washington, where he helped grow a treatment program serving the predominantly homeless opioid-using population in Seattle. He has also worked as a family physician and the Director of Addiction Services at Mary Center for Maternal and Child Care in Washington, D.C. since 2015. So welcome, Dr. Smith.
Great. Thank you for that introduction. And I just wanted to thank everyone for the invitation today and the opportunity to talk about my two favorite things, which are Mary Center and the addiction services that we provide here. Thank you. So I'll just start by giving a brief introduction about Mary Center. Mary Center is a truly incredible place in Washington, D.C., and we are currently celebrating our 30th anniversary. It was started by a truly incredible person named Maria Gomez in 1989. She was a nurse, and it was created in response to the significant influx of immigrants from mostly El Salvador and Guatemala to Washington, D.C. Amidst the wars and extreme poverty that people were facing in Central America at the time. So there was a major need in the community here to serve the Spanish-speaking, newly immigrated population, and Maria Gomez really met that challenge. So at first, Mary Center served just pregnant women, or predominantly pregnant women, with midwife care in a small basement. And in their first year, in 1989, they served 200 patients. Now, over time, Mary Center has grown incredibly to a very comprehensive community health center. We now have 8 clinics throughout Washington, D.C., and in the nearby Maryland suburbs. And last year, we served 53,000 patients. The whole dogma of Mary Center is to not just focus on single problems in a patient's situation, not just focus on one health issue, but to really look at the patient as a whole, their living situation, their education situation, all of that together, and really try to address that to seek best outcomes. So Mary Center uses the social change model where when you become a participant here, you are signing on to many different types of services. And we have family support workers, or social workers, mental health professionals, many different types of services that we provide that we help support our participants to get through kind of anything that they're facing. So, I'm a primary care physician first and foremost. So when I think about my patients, for example, that have diabetes or high blood pressure, I can't address those needs without first making sure that my patients have a refrigerator to put their insulin in or have a safe place to stay, that sort of thing. So the really comprehensive social change approach that Mary Center takes helps address that. The other thing that Mary Center does, which is truly incredible and really drew me to it when I was looking for a job, is the education that is provided here. So Mary Center has started Berea Public Charter School that helps provide education both for adults in the form of English classes, education for medical assistant training, for other sorts of certificate training like that, but also pre-K services for the children of those adult students. So it's really a model where we aren't just addressing the health needs of our participants, but also the educational and social services needs as well. So what I'm here to talk about today are the addiction services that we provide. This is something that is really just my pride and joy, and I am thrilled that I get to work on this every day. I came to Mary Center in 2015, and I had a great deal of experience working with substance use disorders during my residency training in Seattle, Washington. The clinic that I worked at there had a needle exchange, and we had grown a buprenorphine or medication-assisted treatment program there to help patients in recovery from opiate use disorder or heroin use disorder. So after coming to Mary Center, I was given the opportunity, very thankful, to start that sort of treatment here at Mary Center and to use all of the wonderful services that Mary Center provides to serve our neighbors here in D.C. that are recovering from opiate use disorder. So at first we started with one patient who was already a primary care patient here at Mary Center, but over the past 3 years we've grown and we've seen over 500 patients, And right now we have 200 active patients in treatment for opiate use disorder or alcohol use disorder. And the majority of them have been in treatment for over a year. Retention is really our #1 priority. We know that patients with substance use disorders who are in treatment, actively in treatment, have lower relapse rates, have lower overdose rates, and also have lives less affected by the consequences of relapse and overdose. So our patients, while in treatment, can be better parents, they can be better employees, they can meet the needs of those around them. So our #1 goal here is to keep patients in treatment so that they can meet all their other needs and goals. So I think the most important facets of our overdose prevention program are listed on this slide. And I think that most important are the first and the last. It's radical respect and flexibility. And I know that those are a little bit fluffy things to describe, but truly, I think that they're the most important. So the opiate using community, especially here in DC, is a community that has largely been ignored by the healthcare services. They're people who often have been pushed away from healthcare services. What I love about our program is we're able to flip that on our head. We're begging patients to come to us. We go to the community and recruit patients. We want people here. So one thing that's been really interesting at Mary Center, like I mentioned, is that Mary Center started serving the Latino community, recently immigrated pregnant women, and we have continued, our primary care population continues to be 70% Latino. Now, as we've grown our addiction treatment services, we've had a demographic change. So the demographics of opiate use disorder in Washington, D.C. show that it is largely, the majority of patients dealing with heroin addiction and opiate use disorder are older African-American men. And so the average patient coming in our doors looks different than the average patient who comes here for prenatal care. So we have been very deliberate in training our staff, working with staff about meeting patients where they are. Don't bring or trying to address your implicit bias and trying to make sure that we create a welcoming environment for everyone who comes to Mary Center. Now, I think just greeting our patients with addiction with a smile, calling them by their name, telling them that we're glad to see them, makes a difference. And people love coming to Mary Center. We get positive feedback from our addiction patients on a daily basis, and it just really warms our hearts. Now, I think what has really helped for our ability to keep patients in treatment is our flexibility. So we are a federally qualified health center, and I'm sure many people on this webinar right now work at federally qualified health centers. There is a real demand to see many patients throughout the day, and our schedules are rigid, but we have made a deliberate effort to try to be flexible with our patients in recovery. So patients who come late, patients who walk in like a day early or a day late, we try to see them and accommodate them. We know that the patients asking for help, the ones that are here in our office are the ones that we have the best chance of serving and preventing overdose in. So we bend over backwards to try to see those patients. And that is a hard thing to put into a like a health center or a hospital on the large scale, but I think it really fits with the guiding principles of Mary Center. We work here because we want to serve those most vulnerable, and those most vulnerable may not be able to make their appointments on time. So in order to help people with that, we provide them with transportation to get to their appointments. We help them pursue employment and housing, navigate the other social service agencies in the city. Now, I'm not going to focus as much on the medically assisted treatment and naloxone distribution because those are programs that happen elsewhere, all over the country, and that is that's the reason the program exists, is for medically assisted treatment, but I think what makes our program stand out and makes our retention numbers so high are these other things, the respect and flexibility. So I think that I'll probably leave it at that, and then I can answer any questions that come up as we go forward.
Thank you, Dr. Smith, and I really do appreciate you adding the importance of that cultural competence piece. Very, very, very important to mention. Also, let me re-emphasize to everybody who's listening to the webinar, please, if you have questions, go to the chat pod and list your questions, and we will get to them at the end of the presentations. But next up, we have Alissa Ozenberger, and she will share more about the work that she is leading in the state of Missouri. Now, Alissa is the Deputy Director for ACT Missouri, and in her 15 years at ACT Missouri, she's spearheaded numerous efforts to keep Missouri youth alcohol and drug free. She holds a Master's of Education, she is a licensed professional counselor, and she is a Missouri Advanced Prevention Specialist. So welcome, and hopefully I've been saying your name right, Alissa.
You got it. You said it just fine. Thank you so much for having me. I appreciate being able to share information with colleagues around the country. This is very exciting. ACT Missouri has been around for about 27 years, and I chose to focus on the infrastructure that we have built here in Missouri because it works really well for us with us being a relatively large state, and we have many rural communities as well in Missouri. So we're spread out all over the place. So it could be very challenging to work with our coalitions. So with that being said, ACT Missouri is the training and technical assistance provider for the state of Missouri. And I will pull up the map here in a minute, but ACT Missouri serves 10 prevention resource centers that are spread out around the state, which in turn serves about 160 registered coalitions in Missouri. And that's quite a few coalitions, like I said. I chose to focus on the infrastructure because of some of the good work that has come out of this. I would love to highlight all 160 of our coalitions because they all do such unique and innovative prevention work around the state, but of course, you know, we're only here for an hour and a half, so it'd probably take me a good week to do that. But they're the true champions that work around the state. So here is our Prevention Resource Center map, and you can see ACT Missouri is right there in the middle. We're in the capital city of Jefferson City, and you can see our regional or our prevention resource centers spread around the state, and some of them cover very, very large areas. And as you can see, the ones that don't cover area actually cover more population, like our St. Louis and Kansas City folks. It doesn't look like they cover as much, but of course the population is a lot more in those areas. So our prevention resource centers have, each one of them has a director, a prevention director, and they have staff as well. Some of them have more staff than others, of course. And these are our movers and shakers in the state, if you will. Like I said, they're the ones that are directly working with the 160 registered coalitions around the state. So we created what we call our prevention network, and it is made up of all of the prevention resource centers around the state. And all of the directors and staff were looking for a way that we could share information. And they worked and worked and worked on this, and the network was the obvious choice because we have monthly teleconference meetings. And then we try and meet a couple times in person throughout the year as well to share ideas and to brainstorm. One of the things that they wanted to do was they wanted to create a statewide campaign. And they struggled for many years to do this because, like everybody else's state, you have different areas of concern in different communities. So there wasn't one specific thing that we could target until the opioid crisis hit, of course. So our St. Louis communities were the hardest hit at first, and then like any other substance, it gradually made its way across the state. So our friends in St. Louis at the National Council on Alcoholism and Drug Dependency, they came up with this Talk About It campaign. And the website for it is talkaboutitmo, like Missouri, MO.com. So I encourage you to go look it up. This is extensive resources with talking to your kids and young acquaintances that you might have, like say you go to a community center, but you don't necessarily have kids, but you interact with kids. It's a way to help you start the conversation about prescription drugs and opioid use. And very, very clear talking points, very, very clear toolkits that are involved. There's classroom stuff, there's stuff you can do at home. So it's a very, very comprehensive look at just making sure that adults know how to talk to our children about this epidemic that we have going on here in Missouri, but of course all over the country as well. So that's what I wanted to highlight, was the fact that we have this infrastructure in our place. And I know some other states are like this, but I know that they're few and far between. And this infrastructure really serves us well to push prevention out all across Missouri. And yes, I'm sorry I went through that web address very quickly. The Talk About It website, you can find it at talkaboutitmo, like as in the abbreviation for Missouri, MO.com. And it's also on our website as well. And here is my contact information. I would be happy, like I said, I would love to highlight everything that our coalitions are doing across the state, but it's too extensive to do. So please feel free to contact me if you think, hey, I have a rural coalition and I could use some ideas for that. And our website, actmissouri.org, also we put down on the funding page, we put down the projects that are funded, a little description of those. So if you have some coalitions that are looking to add something new, and that's all of our coalitions, from our urban to our rural coalitions. So share that with your folks as well, because I think that that could be a really good resource. And with that, I will finish, and I look forward to questions at the end. Thank you so much.
Thank you, Alissa. I am so glad that you're a part of the panel, because you're absolutely right. The infrastructure that you guys have there in Missouri is very, very unique, and I can't wait to ask you some questions about some of the prevention strategies that you use for your coalitions. So, our final panelist is the Reverend Walter Jones, Jr. Reverend Jones is also the founder and executive director of Fathers Who Care, which we will learn more about shortly. Reverend Jones is a native of Chicago, Illinois. He has a master's degree in theology and urban ministry from GMOR Theological Institute, as well as a bachelor's degree from Southern Illinois University. Reverend Jones is an associate pastor at New Mount Pilgrim Church and is extremely, and probably is one of the most passionate people I know talking about social justice, youth leadership and development, community organizing, and empowerment. So welcome, Reverend Jones. I am very excited to have you here on today's panel. Reverend Jones, can I get you to unmute your line?
Yes. Can you hear me now?
I can hear you now, loud and clear. Thank you.
Yeah, forgive me. I had it muted because I didn't want to disturb anyone. But thank you so much, David, and the staff of SAMHSA for another opportunity to share with the distinguished panelists some of the work that we're doing across the country and how we can collaboratively make things work. Of course, I'm extraordinarily passionate about the work that we're doing, and we take it extremely serious here in the city of Chicago, particularly on the west side. The work on the west side of Chicago is a little bit different than other communities in that, one, it's an urban community. Two, particularly West Garfield Park is considered per capita contains most of the deaths, most violently and chemically dependency in the city of Chicago. So we really have our work cut out for us here in the city of Chicago. Most of the families here in this community are coming from single-family homes. So what we tried to do back in our initiatives to create this organization, we sat down with our congressional leader, Congressman Davis, and we came up with some ideas and some suggestions on what we can do as men to empower our communities. And we felt very serious about men taking the leadership roles in the community. So as a result of that, we came up with a group called Fathers, Families, and Public Policy. And as a result of that, we brought out this organization called Fathers Who Care. So that was many years ago, and so as a result of that, we've been empowering men. Not only men, we've been empowering clergy. From clergy, we've been empowering and mentoring young folks, and we've been taking it to the next level where men are actively involved in the community, actively involved in doing the work in the community, and doing what they can to try to make a difference in the neighborhood. Let's go to the next one, please. So what we want to talk specifically about is how that we're engaging folks in the community. And we're really proud of some of the work we've been doing. We started off here in the city of Chicago with a group called the West Side Men. And we still have that group going on today. And we just, we like to say, and we're very proud to say that we were just able to incorporate this group last week. So this group has now been incorporated and is getting ready to take flight. And then also we have the Illinois Council Responsible Fatherhood. There are only 3 councils in the United States that cater to men or that provide intervention and or support to men, one being Florida, second one being Illinois, and the third one being Ohio in the United States that are provided any type of support. Then we went on to do a lot of work for the former president, President Obama, with the Fatherhood Buzz, where we wanted to make sure that we empower fathers to be more actively involved, not only in the lives of their children, but in their community. So we're extraordinarily serious about men taking a positive role in the neighborhood and bringing about social change in their communities. We have created since that time a group called, we started off with the West Side Community Stakeholders, but since that time and the involvement that we've been having from men and others in the community, we've now have created a group called the West Side Community Stakeholders, along with the West Garfield Park Youth Council, which is made up of 30 young people. And we are very proud of the fact that we have been able to get the 11th, 15th, and 25th District Chicago Police Department actively involved. We've got aldermen from different districts involved, commissioners, we have senators, representatives, of course, our congressmen, and different wards. So as opposed to just dealing with the West Garfield Park community stakeholders, which is made up primarily of the 11th district, we have the 15th district, which is the 29th ward. We have the 25th district, which is the 37th ward. And we have those elected officials and others that are actively involved. And we're extremely proud of that, because now what we're doing is not only are we doing work in those individual communities, but we have the commanders working with us from the 11th, 15th, and 25th district to make social change possible. So things that we're doing in the 11th district, if it's working in the 11th district, we encourage the commanders in the 15th and the 25th district to try some of these ideas. And as a result, they are trying them. So now we're doing collaborative events in all 3 districts. Next, please. So one of the ways that we're engaging and expanding sector partners and making sure folks are actually enjoying the work that they're doing is, oftentimes people they kind of lose their motivation, and sometimes they forget why they're doing what they're doing, and everyone has a season for the work that they do. So what we try to do We all have 12 sector partners, and we're specifically fond of, and we use a great deal of the STIF model, the Strategic Prevention Framework. We're definitely involved in that as far as intervention, training, changing, policies, opportunities. So we use that in the way that we evaluate the work that we're doing. But one special thing that we do to encourage folks to give up their best, the best energy, the best attention, the best resources, is we have a little thing that we do where we compete, where we allow folks to compete for certain sector positions. Not that we don't want anybody involved, we want everyone involved, but we feel that more people are more actively involved when they feel like they have something on the line. So we have 2 or 3 folks that are actively involved in the business sector, 2 or 3 folks actively involved in healthcare. So that gives folks a motivation and kind of the drive to go on and do a little bit extra to show other folks what they're about, what they bring to the table, and how collectively we can all come together to make a serious difference in the community that we're serving. Next, please. We believe, I know it's rather cliched, but we really believe, and we take it real serious, that teamwork can make the dream work. Now, we're using this African proverb here that when spider webs unite, they can tie up a lion. So we are the spider web. And so the spider is the issue that we're facing in our communities. So we're going to use the lion as an example. So if we all come together and we all work together and believe in each other and work with each other, there's nothing too hard for us to do if we work together and do it together. Next one, please. How do we engage our sector partners to work together? Well, first we show members that we all are agents for social change, community empowerment, and we all input matters. Everyone's input matters. There's no big eyes and there's no little U's. We make sure everyone has a voice at the table, and we make sure that we kind of assess the concerns that we all have, and we listen to folks, we give folks the benefit of the doubt, and then we sit down and assess what we're talking about, what we're trying to do, and we do a logic model, action plan, strategic plans, or whatever we need to do to get from point A to point B. The most important thing is social change and environmental social change. That's what we're trying to bring about. Second, we encourage them to use their influences to bring people together and to build their communities. We really believe in the concept of teamwork. Third, it may be not much to some, but it's extremely important for those in this community. We always acknowledge others for the work that they're doing, and we use incentives such as we give out awards, we give out plaques, we give out gift cards, we give out certificates. We have events where we acknowledge individuals for the good work that they're doing. And last but not least, we have business folks who have joined the coalition. And we encourage them to make donations so that anytime we meet and anytime we have activities, we have the business sector group to donate the refreshments for the activities that we're doing in the community. So we really believe that as we come together to do what we need to do to empower each other, we believe we have done a lot of work in urban communities. We've done a lot of work with the clergy. We've done a lot of work with fathers. We're doing a lot of work with the young people to engage, to enlighten, to bring about social change. And we really believe that through the work that we've been doing with community town halls, youth rallies, and men networks, and also our youth leadership and development, where we have young folks now who have their own live television shows, and so they have their television shows, and the senior folks or the elder folks like myself, we have our television show, and so we bridge that intergenerational gap between the young folks and the elders so we can come together. But everyone has their own niche or their own area of focus, but we all come together through communicating with each other and through making things different. Now, one most important thing before I close is, there's a life expectancy here in the city of Chicago which spans 18 to 20 miles. Within that 18 to 20 miles, you can be from the west side, which is where we are now, to right downtown, or to the other side of downtown, which is called the Gold Coast, which is like Wales and North Avenue. So that might be a radius of anywhere from 10, 15 to 20 miles. And within that 10 to 15 to 20 miles, there also is a life expectancy of less than 10 to 15 to 20 years. So basically, from where we're living here, folks here live 10 to 15 or 20 years less than those folks that are 10 to 15, 20 miles away. So that means that there are some things going on, that food deserts. There's some things going on, high poverty. There's some things going on, lack of nutrition, lack of intervention, lack of services, lack of medical care within this 10 to 15 to 20 miles that is impacting folks' lives by 10 to 15 years. So what we're trying to make a difference, we're trying to create change in the community, but we're trying to create sustainable change that can increase folks' lives and let young folks know that they have options. But in order to have options, they have to have opportunities. Next week, please. So additional information, get in touch with Fathers Who Care. You can catch us on the website, Twitter, log in on Twitter, Facebook, Tumblr, all of that good stuff. The young folks got this thing going so fast and so hot. Just anything, you can just log into Fathers Who Care or the Westside Community Stakeholders or the West Garfield Park Community Stakeholders, and you'll find us. And anything we can do to help you, we would love to help you. We believe teamwork can make the dream work. Thank you so very much.
And thank you, Reverend Jones. And as you all can hear, we have quite a diverse panel, and all three of them come at prevention very differently and from very different parts of the country. So before I jump into this panel discussion, I wanted to remind everybody, if you have questions for Reverend Jones or Dr. Smith or Alissa, please go and put those questions in the chat pod. But now, I'm going to jump right into our panel discussion, and I want to pose a few questions myself to the panel before I start to share the questions that have come in from our audience. And one thing that I wanted to start off with, because of the panel that we have, I want to start around this area of how do you just build support for prevention? And I am going to pose these questions, and I want all three of you to jump in to the few questions that I want to throw out at you around building support for prevention. So one, how have you developed prevention programming and built coalitions to expand, impact, and affect change? And I want to throw that out first to Dr. Smith, because I know that ACT Missouri has covered a little bit of this in their presentation, but I want to start with you, Dr. Smith, with this question. How have you developed any prevention programming and built any coalitions to expand impact or affect change in the communities that you serve?
Sure, great. So this is a great question, and I think it is so important because in any city, and I imagine most of the country, there are many agencies working towards really similar goals, but coming from really different perspectives. That is so true here in Washington, D.C. With Mary Center, we provide lots of different types of services, but we don't provide all levels of services. And specifically for addiction care, there are lots of different things that are needed. People need inpatient detoxification. People need 28-day programs. People need housing, all sorts of things. So establishing relationships and building coalitions in the community is just so important. So there are a few ways that we've gone through this. One of them is, I have to say, I was looking through possible questions here for who your prevention heroes are. I have to say, my prevention hero is Maria Page, who's our head care coordinator here at Mary Center, because she is on the phone, got her boots on the ground out in the community all day, every day, trying to build relationships with other agencies here in DC. So we're getting phone calls from detox units, from hospitals, from the central referral agencies in the city, because they know that Maria is going to make sure that those patients get into care with us quickly. And I think that just having open communications with other agencies, letting them know what services you can provide, and being open to act quickly on their referrals to you, and then you can expect the same from them. That sort of back and forth in DC has been working great. I think that this is something that hadn't really happened, in the past here, but DC Department of Health, DC Health, has been really proactive in kind of getting people who are providing services in the addiction space into one room together to try to talk about what services are provided and how we can help each other. So we've been having meetings down at DC Health every few months to kind of put our heads together and figure out how we can work together and go from there. So I think that that's probably the first two places is we just have this incredible care coordinator who's out there building these relationships one-on-one with other agencies, and then DC Health has been really helpful at getting us together with other stakeholders.
Thank you, Dr. Smith. Alissa, I know in your presentation you wanted to talk just a little bit more about your infrastructure. Answer that question for me in the context of maybe highlighting one or two or three of the 160 coalitions that are a part of that infrastructure.
Sure. We have a coalition here that's local in Jefferson City, and it's called the Anne Marie Project, and it formed completely out of preventing suicide. The leader, her name is Julie, she started that with suicide prevention and now has morphed into more mental health, because like many of us, as you get further and further into the field, you're like, this is the problem that we have. Oh, no, wait, we have all of these other issues going on at the same time. So a lot of our coalitions start focusing on one substance or one youth issue, and then they realize that there is a ton of other issues that they need to look at as well. And so I'm really glad that I'm just going to call you Doc because I want to call you Doc, mentioned that as far as utilizing the other folks around the area, because I think that is what our coalitions are best at, is they can identify the problems and they can form those relationships with other agencies, other departments, and they can come together to work on these issues to help make our youth healthier.
Thank you. Reverend Jones, tackle this question for me, and I know you reach and have so many different sectors as a part of your coalition. Answer that question for me using the example of some of the work that you do with young folk.
Most importantly, we believe that young folks matter. Yes, they are actively involved in our coalition. Yes, they are actively involved in our outreach. Yes, they are actively involved in our committees. Our young people have a voice. We listen to them. We're trying to make changes for them, but we don't make decisions for them. We try to set the tone, and we try to give them some shoulders to stand on. Young people are vocal. They're adamant. They're creative. They're outgoing, and they have a mind of their own. And these young people, they have a tendency, to let their voices be heard, because if they're not given a chance to speak, they won't come around. So we are very proud of the fact that we do have the involvement of our young people all the time. They have their youth council meetings every week. They have a television show every week. They're producing television shows every week. In that, we have the parents involved. They have their pitching to one another. They're pitching to other young people in the community. And then we also kind of do some things with them so that every week we're exposing them to different parts of the city so that young folks are getting a chance to travel from one side of the city to the other side of the city, because that was relatively foreign here in the city of Chicago too, of young people being able to leave one side of the city and go to another side of the city without any kind of problems. So we're definitely actively involved in making sure that the young folks are actively involved and that their voices are heard and that they have an opportunity to seek out all the opportunities and options that they can.
So I'm going to tag you a little bit more, Reverend Jones, because I want to transition a question to all three of you, but I'm going to start with you first. Since you just mentioned young people, what is the biggest challenge that you experience regarding substance misuse prevention, not only in the community, but specifically with young people?
Well, thank you for that question. And according to what the young people are saying, first, we don't assume we know what they're thinking. We actually question the young folks or inquire to the young people what are they going through, and they actually tell us exactly what's going on. You would be surprised what's happening out here. You know, there are things out here that they're calling Legos, which are pills now. They got, of course, you heard them at some pills called Molly, Zendax, and they out here using, of course, the issues of underage drinking. They got drinks up here now that are fruit drinks that are called Four Loko. Four Loko. These drinks look like they're in cans like Arizona sodas or drinks. But now they're called Four Loko, and these young people are purchasing these drinks, and they're drinking these with marijuana. So, of course, K2 and Spice was on the high at one point until so many young folks were dying as a result of it. And we know what K2 and Spice is of course, potpourri. And then, of course, the young people out here using loud. Well, most folks think that loud is just marijuana that's rolled up in cigar paper. But no, the loud is actually the marijuana that's been dipped and soaked in other kind of chemicals, which make the marijuana smell a lot differently than the regular marijuana would smell. So that makes it the marijuana more potent than the regular marijuana that someone may plant and produce. And, of course, we have the issues with opioids. Opioid has always been an issue, but now it's an issue of great importance now, because now we're starting to document how many folks are actually dying as a result of it. And so the young people are actually involved with us on getting this information. And one more thing that's trending real heavily in the community is the drink that's called lean. Now, for those of you who have any consciousness of hip-hop, lean is a drink that most rappers are drinking or using these days, that they be like some guy named Lil Wayne, who's a rapper. He has it in a red cup, and this drink has Robitussin in it, and then Jolly Ranchers, and then he used to put a peel or something in there, and some Sprite. Well, now the young people are putting the Robitussin in the cup, plus Hennessy, plus the Jolly Rancher, and a peel. And so these young folks now are taking their, get higher to another level. So those are some of the things that are actually trending in our community, and those are the same issues that are most concerned to us, because now these young folks are getting higher than folks were getting high with these things before, because they've added a different twist and more potency to what they're getting high on.
Thank you. Dr. Smith, you want to take this question? What is the biggest challenge you experience regarding substance misuse prevention in your community?
I think that are you talking about for youth in general, or for youth specifically, or the population in general?
Just the population in general.
Yeah, I think that the struggle that we see here in Washington, D.C. that is so challenging is really the disproportionate access to care and positive activities. So there, DC is a very diverse city, but there's not nearly equitable distribution of resources. So depending on what neighborhood, what ward of the city you grow up in, it largely determines the quality of schools that you will have, the quality of after-school activities you'll have, the types of support services you'll have. So I think that that translates into adults as well. So most of the opiate-related deaths in this city happen in Ward 7 and 8 in Southeast DC, but the vast majority of healthcare services and addiction services are in other parts of the city. Now, the folks on this webinar are from other parts of the country, like Missouri is this humongous state. DC is very small, and everyone knows that. But I think most people probably don't know that to get to my clinic from some parts of the city, patients have to take the bus over 2 hours. Now that is a barrier to care that is just unacceptable. So, we have tried to tackle that both by providing transportation for patients and then starting telemedicine services for patients in other parts of the city. But I think that without acknowledging how disproportionate the distribution of resources is, it's going to be impossible to take on some of these issues. So I just kind of piggybacking on the last speaker is I completely agree with you around marijuana in the youth population, is that DC has decriminalized marijuana use, and I see this a lot in my teen patients just as a primary care doctor, as the ambivalence towards marijuana use and in teens is challenging to work with. Is that, the fact that there isn't nearly the legal enforcement that there once was, which I'm not saying that there should be, but what I'm saying is that it has changed the culture around marijuana use in many of our teens, and it's been something that we're trying to figure out how to best address. So that is something that lately has been in my mind and has been coming up with patients. So that's where my brain went on that question. So I hope that was helpful.
Alissa?
Yes, sir.
What's your biggest challenge?
I'm sorry. Repeat that.
I said, what is the biggest challenge that you experience, specifically in trying to hold together these coalitions?
Wow, that's a hard question. The biggest challenge in trying to hold together these coalitions is the fact that they are so unique. I think a lot of times people think cookie cutter coalitions, and that might be how it starts, that they have the SPIF and the strategic prevention framework, and you have a model, you have the 12 sectors of the community that come in, so I think people think it's cookie cutter, but once they start doing programming and they get out and talk to people in the community of what's going on, especially the youth, I'm so glad the Reverend said that, because I always told adults, I said, if you get out and talk, ask the youth, they will tell you exactly what you need to know, whether you like it or not, but they will. So I think that is one of the biggest challenges, is then they morph into this unique coalition, which is great because that's what serves the community. From a state perspective, that's a little bit harder to look at it that way because they're so unique and they have so many different needs. Thankfully, a lot of the training that we provide on drug trends and things like that, and we're always going to have an alcohol problem, a marijuana problem, and a tobacco problem. So we try and really focus on those three substances. Of course, we address the other ones that trend up and down, but we really try to make sure that we address those three for the core of what we do here in Missouri, because we know that those are the ones that are affecting our youth the most.
Thank you. I'm actually kind of surprised that not any of you mentioned funding as a challenge. So I'm going to pivot to a question about funding, because I know all three of you are supported with not only some state funding, but with with federal funding as well. So this question is, how do you sustain your activities and your efforts after maybe some federal funding has left your programs? And I want to start with you, Reverend Jones. How do you sustain some of your efforts in your programming beyond some of the federal funding that you have?
Well, just for the record, let me help you, David. Yes, we need funding. How about that? But you know, I come from the school of you have to be creative, and so in being creative, that means you have to be relentless. And from the trainings that I've been receiving through SAMHSA and through all of the involvement that I've been exposed to in my years with SAMHSA, I've learned that if you can bring folks together, and here you go with that cliche again, teamwork can make the dream work. So if you really utilize the coalition, if you really utilize your sector partners, you know, you'll be surprised what you can find. Now, of course, you know, we all need resources, but in lieu of resources, how would we sustain ourselves? Well, we would go out and we'll tap the banks. We'd go out and we'll tap the businesses, or we'd go out and tap some of our healthcare partners, or we'd do some little small fundraisers, and we'd do some things to try to generate some extra dollars. And then we'll apply for funding here through the city, and we'll apply for funding through the state. So we're always going to do something to keep a few resources coming in, like every quarter do a fundraiser, and then probably try to, you know, sell some things here, T-shirts there. I mean, you would have to really be creative, but I really do believe that we have to generate some resources to keep the work actively involved, to keep the folks actively involved, and I believe we can make it happen. But in lieu of not having the resources, I believe if we really stay true to the coalition and we stay true to the model, to the SPIF model, I believe we can make things happen.
So, Alissa, I want to pose that same question to you. Could you give me a specific example of how you would sustain funding after or beyond any of the federal funding that you or that one of your coalitions would receive?
It's really funny that you gave us this question, because when you asked me my biggest challenge, that honestly was the first thing that popped into my head. I try not to go there because prevention is organic anyway. We've been doing prevention for thousands of years. We just didn't have a fancy name for it and all the science behind it. Yeah, so it's organic, so I'm not so naive to be like, oh, everything's going to be fine if we lose funding. Of course we will have programming go away if we lose funding. But I always like to remind people that prevention is organic. And we do it every day, and we don't even think about it, even if we're not in the field, because we're parents, we're community members, and we live in this world. So with that being said, I'll get off that soapbox. This actually did happen to us. We have a youth program that we run here, and it's statewide, and it's called the Youth Ambassador Program, and it's an application process for kids all around the state of Missouri, and open to high school freshmen through seniors. And we created this program for the kids in our state that weren't connected to an adult or a youth coalition but still wanted to be involved in prevention. So, and I can't even remember how long it's been going on now, 10, 12 years. Our funding was cut for it. The state decided that they weren't going to support this anymore. And so we, and thankfully, have gotten creative with my coordinator who runs the program, and we've just started private fundraising for it to sustain the program. And I know that would be difficult for an agency, especially a big agency, but I think a lot of times that's what we have to look to with our community supporters, and especially those who have a vested interest in youth. So that's just one example of how we did it. As far as fundraising goes, we started off with a breakfast, and then we had moved it to a lunch. And our first breakfast that we did, my coordinator who runs the Youth Ambassador program now was actually one of my first youth ambassadors when we started the program. So he got to come back and speak about the program and how it helped him. And he's just a great poster child for me because, like I said, he was my first youth ambassador, and now he's running the program. So it's pretty amazing how generous our communities will be, especially when it comes to youth and keeping them safe and healthy.
Thank you. So, Dr. Smith, I'm going to ask that same question of you because we've gotten this question a lot from participants. Could you give me one idea how you sustain beyond funding, but could you couch it from the perspective of being from a bigger city, unlike Missouri?
Yeah, absolutely. So I think that Mary Center, where I work, kind of organically grew up in an environment where funding was a challenge. So we have 8 clinics, but several of them are in Maryland. Now in D.C., many of you on this webinar may not know, D.C. has expanded Medicaid to undocumented immigrants. So most of our patients in D.C. have insurance through expanded Medicaid, and their visits with the doctor are reimbursed by insurance companies to our clinic. Now we have, in our 30-year history, been using the proceeds of those reimbursed visits to help provide care for the large portion of our patient population that doesn't have insurance, which is mostly in Maryland. So we're kind of raised and the clinic developed in an environment where we're trying to work with very sparse resources, just like everybody else, all the other panel members. Now, we have been very dependent on funding from the DC government and the federal government to expand our programs, but thankfully, all of these visits are reimbursable with Medicaid and insurance, so we can get paid for these. The problem is that care coordination, we have 3 full-time care coordinators that work on our program, and their services are not billable to insurance at this time. So we've been trying to advocate through the DC City Council and DC government to try to change that so that these would be billable services. And, we've gotten some traction, but the policies haven't changed yet. So we've had to be creative with that. And I think that probably the short answer is we just continue to be in desperate pursuit of funds at all times. So any opportunities for requests for proposals that come up with government agencies, insurance companies, private donors, we are applying constantly. And I think that might just be the reality of this work.
Thank you. So I appreciate all those ideas that came from all 3 of you. I'm gonna pivot to what are some of the prevention strategies that you guys use. So drawing on your experience, let us all know what tools or resources have been most helpful or most effective in strengthening your prevention work in your communities. And I'm going to start first with Reverend Jones.
Well, if I heard you correctly, you say what tools have been beneficial in the work we've been doing?
Yep. What tools or resources have been most helpful to you? Go ahead.
Well,
I'm sorry.
I like to start off by saying that Prevention Day, the information that we've been receiving through SAMHSA, the tools that we've been receiving through SAMHSA, has been extremely beneficial in identifying, assessing, and providing intervention and/or treatment. The fact that we've learned how to possibly bring people together to educate, to engage, and to provide enrichment activities and services to folks. And I believe that the fact that even the work that you're doing now, David, to let folks know that it's okay to communicate, that it's okay to share resources, that it's okay to share ideas, that it's okay to be living in Illinois and also someone living in Missouri or someone living in D.C. or whatever they may live in. We can get on the webinar and we can share the good and the bad, the difference and the successes with each other, and don't take it personal thinking that someone may take your ideas, because they're not taking your ideas. We're sharing ideas. We're engaging folks. We're enlightening folks. We're empowering folks. So we have seen a lot of differences, a lot of changes, a lot of interventions, a lot of support coming as a result of being able to build bridges, to build supports for prevention, to do the work that we're doing now. And I want to say to you personally, David, that you bring a certain energy back into this field that is desperately needed. So keep up the good work.
Well, thank you, sir. I appreciate that. Alissa, take that question for me. Drawing from your experience, what tools or resources have been most helpful or effective in you strengthening your prevention work with all of the 160 coalitions that you have as a part of that network?
We disperse funding through ACT Missouri to the coalitions, and we require them to use the strategic prevention framework. And a lot of times that really makes people leery because they think it's too hard or they can't do it. And we really take the time to be like, you're probably already doing it anyway, but now let's just solidify it and put the plan on paper so we have something to follow. Because a lot of times here in Missouri, and I assume probably all over the country, our coalition volunteers they come to the table because they're passionate, that they want to do something, they want to make change. And a lot of times it's, well, let's just hop into it and let's go plan something and do something. And we really tried to not diminish that because, of course, you have to kind of be, you have to walk on eggshells with that because you don't want to kill their spark, but you need to come back and say, okay, what populations are we going to look at? What's the problem? How will that come into play with the problem? So the strategic prevention framework, and I know I kind of used to be like, oh, do we really have to spiff that is, what we call it, but it's tried and true, and it helps, and our coalitions might drag their feet going into it, but after they do the plan and work it out and then see that they can evaluate it, they're sold and they're ready to do it again.
Thank you. A question that just came in that I find very interesting, and actually it ties back to some responses that you guys were talking about when it comes to ideas about moving beyond funding. How are all of you adapting to this trend to medicalize prevention such that prevention becomes a fee-for-service activity where services are paid with Medicare or Medi-Cal or other government funding?
Can we just jump in as needed?
Jump in as needed.
Okay. It's really funny that you asked that question because I see it's Beverly Watts Davis, so I'm not surprised she asked that question. We've been talking about this for a while in Missouri, I know, and my short answer is going to be we can't wrap our heads around what this will look like. And we've sat through meetings where we've tried to brainstorm and things like that, but until we become more behavioral health centered, and we're working to that. We, like at the Department of Mental Health, our SSA, they have merged our state advisory councils. They've merged substance use and mental health together. So we're all starting to come together and have these conversations. It's just a huge culture shift, and it's taking some time. But if anyone else has any other suggestions, I would be all ears for that.
I'm definitely interested in hearing how you're dealing with this, Reverend Jones, and then definitely get in there, Dr. Smith, right after Reverend Jones.
Well, we've encountered the thought of a fee for services. We're not quite there yet, but we are looking at it, and we're talking to some of the powers to be to see what we can do to kind of transition some of the work that we're doing into one of those departments, agencies. So right now it's on the table. I think it wouldn't be a bad thing if we can possibly continue this discussion and find out possible ways that service providers can transition into that particular field of fee-for-service.
Dr. Smith?
Yeah, so we have had, like I kind of alluded to earlier, I guess it's important to recognize that what we're doing right now is not the prevention on the level that the other two providers or the other two panel members are. We're kind of doing more of the relapse prevention, overdose prevention in people who already have opioid use disorder. So the ship is out of the harbor in that respect. So we kind of have to fall into that fee-for-service existing model for Medicaid and insurance reimbursement in order, because this is considered primary care. So these get billed just as primary care services. Now, the prevention work that we do around that, so like the care coordination, the plugging into mental health services, the case management, all that sort of stuff, yeah, that's not reimbursable, and you can't do that on a fee-for-service way. Because the existing infrastructure is so strong around fee-for-service medicine, which is suboptimal, I can say comfortably. I think that what we've done is we've just tried to advocate for those sorts of services to be reimbursable and to be able to reimburse for them. And that doesn't necessarily have to be fee-for-service, like each consultation or each session gets billed, but having government agencies or insurance companies reimburse lump sum for prevention services doesn't strike me as the worst thing possible. I think that the details need to be worked out, but I think that we have to work with the system that exists, even if it's suboptimal. So that's kind of what we've done, and we try to advocate to make services that weren't previously reimbursable so that we could continue to provide them.
Thank you, sir. And actually, thank you for that distinction too. Last question before we wrap up to all of you. Well, actually, Reverend Jones, you've already answered this, so I'm going to shout this out to the other two. Who is your prevention champion, and how would you describe them in one word? And I'm only asking this question because it ties back to the whole theme of this webinar in general. Who is your prevention champion, and how would you describe them in one word? Alissa?
I knew that was going to be the question that you asked. Like I said, we have so many prevention champions here in the state of Missouri. I would say probably the first person that pops to my mind, we were talking about this at lunch today, is, again, it's a local coalition we have here in town called the Council for Drug-Free Youth, and the executive director is Joy Sweeney. And yes, she is paid to run this agency and this coalition, but she is one of those people who would do it if she lost her job. She is so vested in this community and vested in our youth, and I would say probably, I'm going to do two words, but it's Energizer Bunny. She just goes, and we're all in awe of her.
Thank you, ma'am. And I was wrong. I meant to say that it was Dr. Smith who already gave us our prevention champion. So I'm going to throw this last question to you, Reverend Jones. Who is your prevention champion, and how would you describe them in one word?
Thank you again, David. Our prevention champion would be our very own Congressman Danny K. Davis. The word we would choose to explain him or to note him would be relentless. He's relentless.
Thank you, sir. And thank the entire panel. Thank everybody who participated in this webinar. I hope you guys found it not only thought-provoking, but I hope it was inspirational, and it gave you some thought as to the importance of prevention, and more importantly, the importance of prevention champions in this work that we do. I want to let you guys know that we have one more webinar in our webinar series, so I want you to join us for our next webinar in May, actually during National Prevention Week, when we will actually hear from youth and young adult champions who are leading substance use prevention work in their own unique ways. I'm incredibly excited about this webinar because it offers the opportunity for you to hear firsthand from our future prevention leaders doing this work right now with their peers. So for those of us who are trying to get ideas on how to engage young people, this is a wonderful opportunity to be able to learn from young people who have expertise in this area. Additionally, SAMHSA is releasing new Tips for Teens publications as a part of National Prevention Week, which you will learn more about during the webinar. So visit the MPW website again at www.samhsa.gov/prevention-week to register. You can also find past webinars that are archived on SAMHSA's YouTube page and the MPW website. Like I said, I hope that you have found this information in this webinar valuable. Please let us know what you thought about this webinar by filling out the post-meeting survey that will pop up once this webinar ends, because your feedback is extremely valuable to us, and it helps us as we plan future webinars. So with all of that said, thank you again to our panelists, and I hope you have a wonderful and splendid day.
This does conclude today's conference call. You may now disconnect and have a wonderful day. you.